Today, we're joined by Fay, and Fay's an ER nurse at KGH. Um, we really appreciate you coming on and being able to speak with us today. Surprisingly, ER nursing and critical care nursing is a big interest among the nursing students at Queen's. So it's awesome that we're able to have you on and talk to you today about everything like that. I'll get started with the first question for you today. So how long have you been working as an ER nurse?
Been working in Emerge for about 9 months or so. I started in May of 2020, it would have been, and have continued through to now. So really, I've only ever known the emergency department through the lens of COVID. So it'll be interesting and come hopefully very soon to get to know it a bit better when it's not in the midst of a pandemic.
Yeah, for sure.
Faye, did you consolidate in the emergency department and then you're just hired on afterwards?
I did, yeah. So I graduated Queen's in May of 2020, and I was really fortunate. I had a consolidation placement in the emergency department at KGH, and it was a pretty seamless transition. I went from working, and I think I ended my placement in early April, and then I started working there in May.
Awesome. And I have your next question here. So with regards to working in the emergency department, is there any education or further certification required to work there?
Typically, ACLS is recommended within a year of starting. And I found actually Queen's program did an excellent job of doing their recess rounds in fourth year, which you don't get an ACLS certification on paper, but you use the same algorithms, and it's a great amount of familiarity to have with what you would do in those scenarios, and then you get the certification after you graduate.
Awesome. I have your next question.
Yeah.
Students are wondering, is it difficult to become an ER nurse? Like, what does the job availability look like these days?
I can only speak from my own experience. It wasn't incredibly difficult for me. Like I said, I was really fortunate and I was able to consolidate there. But I mean, patient volumes are only increasing along with acuity, and emerges are getting busier and busier, especially now amid COVID. So I think there's great availability out there. It's all about making yourself employable. Like I said, having certifications like ACLS. There's also PALS, which is similar to ACLS, but it focuses on pediatric resuscitation. But I'd say that if you were looking for a job in the emergency department, there's lots of opportunities right now.
Okay. Could you tell us what those two acronyms you just said stand for, the ACLS and PALS?
Absolutely. So ACLS is Advanced Cardiac Life Support. And getting that certification is, I think it's a 2-day course, and it goes through all the algorithms that you would use in your resuscitation situations. So Alex can speak to this as well, but it would go over your VTAC, your VFib, your asystole algorithms, your bradycardia algorithms. And when you get down to it, Emerge, the bread and butter is resuscitation. And you hope that you don't get there, but knowing what to do in those situations gives you a good amount of confidence. And then your PALS is your Pediatric Advanced Life Support course. Similarly, it works with those algorithms for what you would do in the scenarios, but it has a special focus on respiratory care and the various kinds of shocks, because in your pediatric population, typically it's less cardiac related and more respiratory related when they do unfortunately code.
Awesome.
Thank you.
Thanks for clarifying that.
Sorry, yeah. Could you describe what an average day as an ER nurse looks like?
Meg, that's kind of the beauty of it. There is no average day. So it varies so much, which is great. If you're someone who likes stability and knowing exactly what to expect in each day, I would say maybe Emerge isn't the best spot for you, but I love going to work and knowing that I have no clue what my day looks like. So some days you can get to work and you can only have a few patients, and maybe you get started, you assess the patients that you have, and then you unload some ambulances. So what that looks like is you would take the story from the paramedics and then you would go assess the patient. It's not uncommon to have to start numerous IVs, do blood work, ECGs, urine samples, all those kind of diagnostic things, lots of tests that you would do. So that would be a slower day when you start off with only a few beds. But some days you come on and you have 4 patients in your assignment and in the hallway. So it absolutely depends.
Great. And could you tell us how it compares to, say, a med-surg unit?
Absolutely. So it's a totally different model of care. You're starting fresh. So the patients that come in, you don't know anything about. And so in many ways, you almost have to put on like an imaginary detective hat. And it's interesting because you're assessing them for the very first time. You can't read the dark note of the nurse before you. So you're doing your assessment and you're piecing things together. And typically then there's diagnostic procedures. So your patient doesn't already have an IV. You're starting fresh. So you're probably going to get an IV going and you're probably going to send off some blood work. That blood work's either going to support what you were thinking or it won't support what you were thinking. And then you can kind of collaborate with the physician, see what they're thinking. And then you go from there, really. So you're starting fresh.
So do you,
that question?
yeah. So do those patients, say like you start your shift and then you get a few ambulances with patients. But those patients stay, how long would they be in the ER for? Like say you start an IV and do some tests. How long would the time generally be, like from when they arrive to when they get sent to a different unit in the hospital?
Yeah, so it depends. Going back to Meg's question, the model of care is different because everything's fresh. That's one part of it, but also because you have this new concept of flow. Where on a med-surg unit, you would be concerned about your 4 patients and your 4 patients only. Working in the emergency department, you need to be concerned about the patients in your beds, but also the patients who are waiting to get to your bed. So the people in the waiting room, the people in ambulances offloading. So you're caring for your current patients, but you're also thinking about how you can help facilitate flow and move them through the department. And that's what you were talking about, Karsten, how long it takes. It depends. So it might be that they come in, they have right upper quadrant pain, you do some investigations, they go for a CT scan, and they're diagnosed with a coli. And so then they're consulted over to the general surgeon's service. They come down, they say, you know what, you need to stay in hospital. We're going to do a lap coli, and you'll be admitted to Kid 6. In that case, they get admitted, you call up to the floor, give them a report, and they go up. Depending on what else is happening in the hospital. So is Gen Surg in the OR right now? Are they available to see this patient? Is there a bed available on Kid 6 right now? Or are they waiting for other patients to get discharged? How many investigations are going on? Those are all things that'll factor into what's going on. But ideally, I'd say the average patient, if they are admitted, stays for about 8 hours or so.
Okay, gotcha. So that's why there's a buildup in the ER sometimes, and people will be out in hallways. They're just waiting to be admitted to a different unit.
Absolutely, yes.
Okay.
Other patients won't take as long, so people can walk in and be seen and discharged home within an hour. It all depends on the patient and their acuity and what they need and what resources the hospital has available.
Okay, gotcha. So that actually kind of leads into my next question, which is, what do you think the most difficult part of working in the ER is?
I think it's difficult for 2 reasons. It's difficult not knowing. So there's some cases that stay with you and you really wonder what happened to them, and you don't always get to know. You get to stabilize them and then move them out. And you don't know how their surgery turned out. You don't know how their medical management turned out. And maybe they were really successful and recovered beautifully, or maybe they won't. And the reality is that you don't get to know. So that's challenging. You meet so many people and you send them home or you send them upstairs and you just don't know what comes of all of it. I'd say the other really challenging part is you're often so rushed for time. It's a very task-oriented environment. And sometimes the little things that make nursing so special, it can be really challenging to carve out that time. So little things like talking to a patient about their life and those stories that they have, you can certainly carve out the time. You have to make an effort to do that, but you don't always get to do it. Just because there's more tasks that need to be done. You need to start more IVs, you need to give more medications, you need to see more patients. So those little special moments are fewer, I would say, than somewhere like med-surg where you have more time to spend with your patients.
Okay. And you mentioned you see some difficult things or maybe even traumatic things in the ER. So I know you mentioned earlier in your bio you wrote us that you enjoy spending time outdoors. Do you have any other coping mechanisms you like to use when maybe the shift's over or something tough happens on a shift?
Yeah. I mean, the outdoors is special to me. I would one day love to take nursing outdoors. I haven't quite figured out how yet, but I would love to marry those passions. But in the meantime, I spend lots of time out there. So I'll go out for a hike, any kind of exercise outdoors I find so therapeutic for myself. Going out walking, it's really all there is to do right now. But yeah, getting outdoors, talking to people. My coworker, excellent. It is such a beautiful team-based environment in the emergency department, and being able to talk to them and lean on them and seek support from them is something that I value so much. So yeah, I would say being outdoors, being active, and then leaning on my coworkers.
A little bit of a contrasting question to that. What would you say is the best part of working in the emergency department?
You never get bored, ever. There is never a dull moment, and there is so much to learn. So there's nurses who have worked there for 25 years, and they say they still learn something new every day. It's very difficult to fall into any kind of lull or slump. You don't get stagnant. There's always something new to challenge yourself with. There's always new medical directives. There's always really interesting cases that come through the door. There's just so much to learn. And it's an amazing environment that is so supportive of learning. So I think I really enjoy that. It's a whole other world of medicine and nursing. And there's always something new, always an interesting story, always interesting patients. It's a very interesting place.
Students are wondering, do you have any advice for those who are looking to work in the ER? Some people suggest that it's more beneficial to have med-surg experience first after graduating, but what are your thoughts on all of that?
I think it's dependent on the person. If you're someone who's comfortable being uncomfortable, go for it. There's no better way to learn than jumping in the deep end. If you're someone who knows that they like to have less discomfort in new environments, they like to maybe walk in through the shallow end, I think it's a great idea to start in med-surg and get more comfortable. But I certainly wouldn't discount the option of starting off in emerge right away. And really, that's much to the credit, like I've said, of the wonderful team that's down there. It is such a team-based environment, and they are so supportive of learning. So I think it's more dependent on the person, really. But it can absolutely be done to go right into emerge.
And do you
Awesome.
have any advice for nursing students looking to work in the ER?
Do I have any advice? I would really recommend completing the ACLS course. You can do it as a student. You don't need to be an RN. At least that's my understanding. I thought that was a great little intro. And like I said, if you know what to do in the worst case scenario, it gives you an excellent foundation and just a little bit more confidence to go in. So I would look into doing an ACLS course, and then I would look into getting a placement in Emerge if they're interested in consolidation. I think that was a really, really valuable experience. And as a student, it's a bit of a safer environment. And it was just wonderful to be able to have those experiences.
And I think I have the last question for you. If you're able to share, we were wondering what the strangest thing that has ever happened to you in the or during
The strangest thing.
or just a notable memory you have.
Yeah. I mean, there's always, I don't know if growing up you used to watch those like untold stories from the ER. It's online with that. So there's tons of strange things that happen. People always have a funny story. I had somebody the other week who was on their way to get married and had to stop in with us, and we were trying to get them out the door in time for their wedding. And there's so many funny things. Everyone's got a story. Lots of odd stories to do with odd circumstances and injuries where it doesn't necessarily add up. But there's definitely lots of funny things that happen there.
Sometimes you might have to do a bit of detective work to figure out if they're even telling the truth about their story, maybe.
Absolutely. And sometimes it's not relevant to really what's going on. You know, maybe they got something somewhere where it shouldn't be, and how they got it there doesn't matter. Yeah. And there's always something interesting. There's always a funny story or an interesting story. There's very interesting dynamics between family members, and I'd say I usually get a good chuckle at work.
Yeah, I was wondering how many like family interactions there are, because on all those ER Untold Stories shows, there's always family coming in and like yelling at the healthcare staff and stuff like that. Does that actually happen, or is that just something they throw in those shows to add suspense?
I know family dynamics play a big part, less so right now because of COVID policies and not having any visitors. But we almost add another layer to that because they all phone in. And sometimes you feel like you're managing a family meeting because you get about 5 or 6 calls from family members looking for an update on a patient that may have just come off of the paramedic stretcher 5 minutes ago. So there's lots of managing family and trying to involve them in care as best you can and supporting that patient-centered and family-centered care. But it's not always easy. You're absolutely right.
Gotcha. All right. Well, I think that concludes the questions we have for you. So thank you for joining us. Is there anything else you'd like to mention before we say goodbye?
No, I think that's about it. Emerge is an incredibly rewarding place to work, and I would applaud anyone looking to get into the profession. It's done me very well, and I really enjoy working there.
Awesome. Well, thanks a lot for joining us, Fay. We really appreciate it, and you answered a lot of questions that will definitely help some people out.
Good. I hope so. Yeah. All the best. It was lovely meeting you all.
Awesome.
Thank
Thanks
you so
a lot.
much. Yeah.
Bye-bye.
Bye.